Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. Today, we want to provide an overview of how the One Big Beautiful Bill Act will impact healthcare. If you've been following the podcast or any other hospital channel, then you have seen us advocating for rural health since cuts to Medicaid were first introduced earlier this year. 2 weeks ago, the United States Congress voted to pass the One Big Beautiful Bill Act, and it was signed by the President of the United States on July 4th. Listen, this was not the outcome we wanted, that we fought for, and that we fought very hard to defeat, as we knew there were many harmful provisions in this bill. Now, the bill eliminates nearly $1 trillion from Medicaid and the ACA marketplace funding over the next decade. Now, this will impact every American, or nearly every American, in one capacity or the other. Leading economists and nonpartisan industry experts alike all agree that these deep reductions will limit health services, lead to significant delays in care, shut down essential services like obstetrics and psychiatric care in rural communities. It will create longer wait times in emergency rooms and ultimately overburden healthcare systems. This will lead to accelerated hospital closures across this country. These closures will happen because of the direct result of the vote that Congress took and the president signing. Now, let's look at the bill's provisions and what they mean for specifically rural health. So let's start with work requirements. Able-bodied adults will be required to report 80 hours of working that they've conducted, completing community service, or participating in an educational program every month. Now, while we certainly want to see able-bodied adults engaged in meaningful activity and obviously contributing to the workforce, this monthly reporting adds a significant amount of red tape that will prevent many beneficiaries from staying on Medicaid due to the technology and communication barriers. Number 2, the eligibility redeterminations. Typically, redeterminations are conducted annually and require all Medicaid beneficiaries to renew their enrollment. Under the new legislation, this will be conducted every 6 months, starting at the end of 2026. Now, we have worked with the Department of Health and Human Services to help beneficiaries stay on Medicaid. And through that process, many don't even know about the redetermination, or they simply don't know how to stay enrolled, especially in rural areas where access to proper technology and internet connection is limited. Now, number 3 was the FMAP reductions. The current incentive offered to states to expand their Medicaid programs help them provide more reliable aid to beneficiaries. It sustains rural hospitals with increased federal matching assistant percentages. We call that the FMAP. This incentive will sunset at the end of this year, meaning the states not currently participating in an expansion program will likely not be equipped to do so, and putting many expansion programs and consequently their hospitals at risk. Now, the 4th area was the state-directed payment program. This is one of greatest concern for most rural hospitals. Medicaid state-directed payment program can pay providers up to an average commercial rate of that state, but starting in 2028, the payments will have a new cap, and that cap is based on Medicare payment rates, grossly limiting the ability for hospitals and healthcare organizations to continue operations and to provide those services at a cost for which we're reimbursed. The good news is that the program will be grandfathered to help rural hospitals survive the drastic changes. Now, the 5th and last area I want to talk about today is provider tax. Although Medicaid is a federally funded program, states are allowed to support their individual programs by taxing providers up to 6% of their revenue. This has been the focus of our concern with the legislation from the beginning of the introduction of this bill, because we know that what had been purported was the bill would reduce that allowable percentage to 3.5%. The cap will gradually decrease between 2028 and 2032 and is designed to prevent states from making up the lost funding with other tax structures. Ultimately, the provider tax reduction will result in significant damage to hospitals by stripping the payments that currently support the Medicaid expansion. Now, if you haven't yet listened to last week's episode with Rick Pollack, the president and chief executive officer of the American Hospital Association, add that to your queue to hear Rick's excellent commentary on what the bill means for hospitals in America. If we want to maintain healthcare in rural communities across this country, we must not surrender the fight to protect Medicaid. Even now that the bill has become public law, we still must fight. We must continue to lift up our collective voice to ensure that we protect, defend, and serve the most vulnerable among us. Who are they? They're the elderly, the widows, and the less advantaged, and others who comprise our Medicaid population. The everyday faces of Medicaid, look around you. It's your neighbor. It's your pastor. It's a store clerk. These are individuals that rely on and need their local hospital to provide care. If you want to follow along with Hillsdale Hospital's campaign and help contribute your own voice for the fight, visit hillsdalehospital.com/Medicaid and follow us on Facebook, Instagram, Twitter, LinkedIn, and YouTube. Rural health cannot be sacrificed like this. We must continue to work hard to serve our communities and defend essential programs like Medicaid that equip us to be able to do the job that we do every day. Thanks for joining us on the journey, and stay tuned for our next episode. Thank you to our sources for this episode, Congress.gov and Holland and Knight.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.